This is Max Cameraman, and as a disclaimer, FSM should not take the place of a visit with a medical professional, nor do we have any financial disclosures at this time. So, I think the first question that everybody should be asking themselves when looking at a primary care sports medicine fellowship is the type of fellowship that they want to get into. And there are a couple of big ticket items that I think everybody knows to ask themselves, which is first, do they want to be the single or lone fellow at a program, or to be looking at programs with multiple fellows, giving you somebody to bounce ideas off of? And do you want to be at a university program, being at a community program? I think these have their advantages and disadvantages depending on what your career aspirations are. And I think Ken and I, because we went to the same fellowship, obviously had the same thing in mind for this. And I really have to recommend, I think, at least going to a fellowship that has another fellow at it. I think the process of fellowship is somewhat difficult and a little bit isolating as an experience, and having another fellow there to relay and to discuss thoughts with, I found extremely valuable in trying to transition from a family medicine resident to a sports medicine attending. Ken, what was your experience like with that? Would you do it again?
Yeah, I agree 100%. Actually, the program I wanted to go to only had a single fellow, but I think now in retrospect, having Max there with me to on this ride, on this journey where we can talk to each other, relate with each other, I think it's probably the best choice. But to each their own. It's just there are options. There's either one fellow, two fellows, or multiple fellows.
So I think that'll, of course, come before you actually end up at an interview with the place. You'll know whether or not you're going to be the only fellow there. But I think related to that, or related to what will make a fellowship unique, is determining or being willing to ask what the fellowship is going to offer you in a specific way. And it might not be obvious to everybody, and I don't think it was obvious to me, but that of course, all fellowships are not created equal. I think I had this image in mind when I was applying to fellowships, that beyond the sports exposure that you would get at a given fellowship, that often you were going to be trained in a similar way regarding the specialty of sports medicine, ultrasound techniques, radiology, interpretation. I assumed all of these things would be similar. And the more that I've gone through the fellowship that I finished, and the more that I've discussed this with other people, other attendings, looking at jobs, I've really come to understand that the fellowships are potentially dramatically different. And if I could encourage everybody, this is one of the most important questions I think you can ask at a fellowship interview, which is, how is your fellowship going to distinguish me as a candidate coming out of your fellowship? Ken and I both went to a fellowship, which I'll let Ken talk about this part just because I think it's so dramatic for us as a personal experience. But I think it's something that everybody should be thinking about when looking at their own fellowships.
What do you want me to talk about?
Sorry, with Letty.
Oh, yeah. So every fellowship has their strengths. University of Buffalo, I personally feel like the strength is Dr. Letty, and Dr. Letty is well known in concussion medicine. He came up with the Buffalo concussion treadmill test. And because of that, because of his clinics and the patient he sees, all he sees are concussion patients, and the research that he does, I feel like the training there, in my point of view, was pretty second to none for me. So I feel like I'm well versed in concussion medicine. So University of Buffalo will be well known for its concussion medicine. Other programs will be known for other stuff, whether that be heat illnesses or other related injuries or treatment options. But if you're interested in a specific aspect of fellowship, then you should actually look into that fellowship and maybe even ask that fellowship, what are you guys known for? What do you guys, what type of research do you guys do? If that's something you're interested in. Because some fellowships, even when they come with a big name, don't do research. Their research is not required. It's a year of fellowship, so it's really hard to do research. But our fellowship required research, and we actually got to be part of research, which is really a good asset and a good bullet point also in your CV.
Just to drive home a couple of those points that Ken just makes, I think there was a lot of good information in there. Right now, as Ken and I are applying to jobs, people are aware that we're coming out of a fellowship that had concussion as one of the points of expertise, and it's a marketing point for ourselves. any program that you apply to as a candidate should be able to answer the question of what distinguishes their program as something important or unique. And it's hard to overstate the value of being able to market yourself as an expert in something, even within the world of sports medicine. Some programs have more exposure, of course, to heat illness, to certain procedures. Some have specialists in ultrasound radiology or exposure to high-level professional sports where you as a fellow will get access to that. But I think these are all things that you should be considering when looking at a fellowship. It's not to say that it's bad to go to a community program which doesn't or will not distinguish itself. Depending on your career goals, I think that's very relevant. But you should be aware of what you're going to get out of the program before going into it. The best thing that I could say for everybody is to go in with your eyes wide open, to be aware of what the field looks like. There are a couple of other questions, by the way. We're going to jump topics just slightly here. If anybody has any thoughts about this, we're happy to discuss them in the chat, or if this is triggering anybody's thoughts about their own process of getting into fellowship. I'll just mention before we start our next topic that this is a good place potentially to mention also the difference between doing a sport and spine fellowship, which is offered at a few places around the country. It's not quite as well known as the primary care sports medicine fellowship, but it's a fellowship that's going to have a lot of emphasis on back pain, and it's something that I was looking to avoid. It's a dichotomy that I think you'll find as you get deeper into the sports medicine world, which is that sports medicine physicians are often trying to avoid looking at back pathology because of not only its nebulous nature and chronic type of conditions, but also because you can get pigeonholed as the musculoskeletal specialist. And so if you're interested in back pain, a sport and spine fellowship may be the answer for you. But as somebody who was interested in orthopedic medicine and wanted to see a variety of pathology, I am actively looking to avoid billing myself as a spine specialist despite feeling capable of doing something like that. Ken, is that something that you feel like you've experienced so far, or things that you're thinking about?
That's a great point. And also with sports medicine fellowships, there are actually some sports medicine fellowships that are hosted by family medicine, by ER, by PM&R, by pediatrics. So that might be another thing to look into, because whoever runs the sports medicine program you're probably going to get a little more expertise training in that field.
Totally true. So at this point, I'm just going to list a couple of things that I think people should be willing to ask pointed questions about in interviews and at fellowship, at points to help distinguish different fellowships from one another. A couple of things that I wish that I had known to ask more about are, first of all, the level of ultrasound training that you're going to be able to get at a fellowship. And any fellowship at this point in primary care sports medicine is going to be teaching you about ultrasound, but it's not necessarily going to be the same level of training. And it's important to ask, first of all, how many people are ultrasound trained at a program? How many people will be actually involved in the education of it? Knowing that there's a curriculum involved for the ultrasound, and especially knowing what kind of procedures you're going to be likely to see with the ultrasound, and a number of them. A fellowship ought to be able to tell you with a fair amount of accuracy how many procedures you're likely going to see as the fellow. And this is something that I want to emphasize, that different programs tend to use their ultrasound in different ways. Some programs will use their ultrasound for almost everything, every injection, and will have a variety of exotic injections, whereas others will use it only occasionally or as an adjunct to other types of procedures. This is to say that you want to be able to get through fellowship, assuming that you want to have a breadth of knowledge, able to do injections and diagnostic ultrasound across every joint of the body. You want to feel comfortable looking at all soft tissue pathology. So not only the shoulder and the knee, but also, and hip, but also, of course, elbow, wrist, fingers, ankles, toes, and soft tissue to evaluate compartments.
I would also say to keep a log. Me and Max, we kept a log. And we can see, well, we can't really see it, but me and Max competed It was a friendly competition of who could do the most ultrasound guided procedures. But I think it's really good to keep a log for yourself. That way, when you're filling out your CV at the end of fellowship, you can say, "Hey, I'm actually competent at these procedures because I feel comfortable, not because I did one, because I did multiple." And that question is also relevant not only to the attendings who you're interviewing against, but they're also relevant to the fellows, because the fellows are going to do it right now. So that was my question, and the answer when I went to, there you go, yeah. When I went to interview, the attendees were like, "We do a lot," but I mean, to me, that wasn't an answer that I was comfortable with. I wanted kind of to quantify it. So I asked the fellows, and the fellows they were telling me more about what they do, how often do they do it, do they feel comfortable doing it? Because that's at the end of the day, that's another marketing tool you have. Max and I were talking earlier before this talk that there's two things that primary care sports medicine physicians can do, and that is use the ultrasound and do ultrasound guided procedures. Not to say that orthopedic colleagues can't do it. It's just they just rather not do it, so we do it. And another thing is concussion medicine. So if you can be an expert at those two things, those are great bullet points to leave the fellowship with. So those are, I think, the two important things that you should make sure that whatever fellowship you're picking are strong in those two categories. And you can see here that I beat Max, just FYI. Just kidding. Max actually technically beat me, but I did the most difficult ones.
It was quality over quantity for Ken.
But yeah, so we kept a tally of what we did, just so we can put it in our resume and also tell when they're like, hey, because when I went to multiple interviews, they're like, what ultrasound guide procedures do you do? And I pulled down my list and I was like, I do these, and these, and these. So
I would say that Ken and I had a fairly typical experience for this with regards to ultrasound guided experiences at a university level, but there are programs where you're going to see a dramatic difference in those numbers on both ends, both lower and higher, especially regarding the specificity of what we were trying to inject or to evaluate at times.
Or even the nature of different procedures like prolotherapy, nerve hydrodissections, more exotic procedures that you can do with the ultrasound. I would say our program, we're really good on the fundamentals of it, but we didn't see too much of the exotic procedures.
Yeah, no, I agree. One thing that I want to jump to now also is something that I think everybody's probably thinking of if they're currently applying to fellowship, which is how the fellowships are dealing with COVID-19. And I think that this is probably the number one most important thing that people should be thinking about right now with regards to getting into their fellowships, which is what the world of sports is going to look like a year from now or even currently. There are different models that fellowships are trying to employ right now, some of which are trying to seek out new avenues for sports exposure with athletes. Some are actually extending their fellowships. I know of one in Rochester, for example, that offered their fellow the opportunity to do a 2-year fellowship, I believe. But this is something that the program directors should be able to answer, I believe, in an aggressive way, because assuming that things are going to be fine, or assuming that the education won't be compromised at all by going through a fellowship without having any sports experience, is, I think, going to limit where people end up after their fellowship. It's not to say that people don't learn a lot on the job after finishing a fellowship, and it's not to say that getting through the fellowship and simply having the diploma isn't going to allow you to bill yourself as something, but I think that this is going to potentially leave a dramatic impact on sports, and I would really encourage people to aggressively ask this question as the number one most important question, I think, in fellowship interviews. Ken, what do you think about that?
I agree 100%. You have to know if you're going to get the sports coverage. I think it's a lot of value in that, and depending on how much autonomy you get in treating the athletes. Max and I were really fortunate to get a lot of autonomy with treating the UB athletes. So a ton of experience was learned there, and to be able to have that will be a disservice to you. So that's definitely a great question to ask them. What happened if the season is canceled or for whatever reason we were not able to? Because then it comes down to how many people can be on the field. If the season is not canceled, am I still allowed on the field, or is it just one attending? Is it just the primary attending? So those are all relevant questions that you need to ask.
And I think maybe just to preempt what people may be thinking for themselves, I know or I understand that primary care sports medicine fellowship is a competitive fellowship to get into. And I want to encourage everybody to still be that person who asks these discerning questions for two reasons. One is that this is, of course, your life and your career, and not accepting something less than what your best is capable of is not what I would encourage. But two is that I think that asking these sorts of questions can show philosophically that you're on the same page about what it means to be a sports medicine fellow or a sports medicine physician. And I think it demonstrates something really important to program directors and fellowships. And so just to push back against what I anticipate people might be feeling in terms of their own sense of candidacy, getting into a fellowship is easier, or I think benefited by demonstrating how you are able to navigate these questions and these thoughts. Ken, am I expressing myself clearly enough here, or am I rambling?
No, I think I'm basically trying to say,
yeah, simplify it for me, please.
Ask it in a nice way. Don't be aggressive about it, but you should have the power and the right to be able to ask these questions because it's for your future. So,
no, I think that's basically what I wanted to say. This is one other thing related to this is I think it's relevant to ask what the pass rate is on the CAQ exam for any fellowship that you look at. This is relevant in terms of billing yourself as a sports medicine attending, and you should understand how these statistics are determined. From what I understand of it, it's typically the last 5 years of a program's fellowship that they'll be looking at to create the standard for passing. But you should feel comfortable to ask that and make sure that they're able to answer that as the program directors. Moving on, Ken, are there other specific questions you think that people should be asking or that we should be talking about regarding subspecialties, EAP, musculoskeletal radiology, anything like that that you want to emphasize?
I would say that ask what, in addition to what makes this program special, what type of rotations can you get in addition to just, it's good to work with the primary care sports guide. It's good to work with the ortho sports guys, but it also, or girls or women, both. But it's also good to see what other rotations you can actually rotate on if you have a special interest. If you have concussion medicine, can I do extra rotation on concussion medicine? If you have a special interest in reading radiology, can I do a rotation with radiology? Max and I were really lucky to work with Dr. Notino. He's a fellowship trained from HSS, musculoskeletal radiologist. We learned so much from him, and I think it's really important to be able to leave fellowship being able to read an MRI of the knee, the hip, the shoulder, or even read basics x-rays. I think these are really important. A lot of these institutions you might work with actually require you to read your own images, so you definitely have to be comfortable reading them.
I think that's true. We're going to switch gears a little bit here, and we're going to talk still in terms of recommendations for how to be a good applicant and how to improve one's application, and then maybe talk a little bit about what a day in the life of a primary care sports medicine physician would look like. We got that question on Instagram. We can pause here, though, for about 10 seconds if anybody wants to type a question in also about anything that we've already covered. There was a question from somebody. How much ortho time is too much? Do you mind drilling down on that a little bit in terms of ortho time? Do you mean surgery time or time spent with orthopedists?
Let me give this a shot. So I feel like at the beginning, um, it's really important to work with them. Maybe towards the middle, towards the end of your fellowship, once you're comfortable and all the learning you could have possibly done, it's already there. You feel more than comfortable. At that point, I think it would be a good point for you to actually start rotating a different specialty. Maybe you don't feel comfortable as much in pediatrics. Maybe you go do that. Maybe you don't feel as comfortable with fracture care. Maybe you go do urgent care, orthopedic urgent care. Maybe you don't feel as comfortable with foot and ankle. Go do some foot and ankle. So I think initially it's really good to have that foundation, and then later on in the year will be a good time. But with that being said, some fellowships actually start you from the beginning with like a specialty, foot and ankle, hand and wrist, and what have you. So it just depends. But for us, it was a little different. So that's what I feel like you should ask the fellowship. Do I have the ability to rotate at other place if I feel like I need that? For me, especially since once I leave fellowship, that's it. No more learning for me, handholding. So I need to be leave this as competent as possible.
I'll say, just to add on to that and to give a couple more specifics, the fellowship that Ken and I did was 20% orthopedics throughout the year. And I agree with Ken that the beginning of the year was more helpful than the end of the year. At the beginning of the year, it gave you an opportunity, or gave us an opportunity, to see how orthopedists think, and to have a lot of one-on-one time with them to understand pathology from the perspective of an orthopedist. I felt that I gained a lot by being with them, but by 4 to 6 months into the fellowship, I wasn't seeing enough new pathology with them to justify being involved in these preoperative cases for things that I knew were going to be meniscal repairs, surgical repairs in the shoulder, and it felt like a less valuable moment for me. If I could do things differently for myself, again, I would have tried to advocate more for myself to do more subspecialty rotations in place of that 20% of my time in the second half of the year, especially. Ken, do you basically agree with that?
I agree 100%. And then that's something once you're done with fellowship, you could give that feedback to the PD, and I know that our PD has implemented that in the schedule. So I think that's really important. But definitely speak up for yourself, vouch for yourself, because this is your education. You're there for a year. You want to make sure you learn as much as possible.
And just to pivot off of this as well, I think it's actually, Anton looks like he's asking it also. What did we do with the other 80% of our time? Another 20% of our time was spent in concussion clinic. Another 35%, I want to say, was spent doing primary care sports medicine, where we were working with a variety of primary care sports medicine physicians in their clinic. We had a half day, like what would it be? 10% of our week was reading time, which was to say supposedly time off. We had 10% as a not subspecialty, sorry, our original specialty of family medicine, and then a research meeting that we would do once per week for 2 hours, where we would discuss ongoing research projects that were taking place in the concussion lab, from which we took a very small portion to create our research projects.
With that being said, that's your basic schedule. That's not to include the didactics you have to go to in the morning or the evening, the training room you have to attend in the evening. That's another good question. How much training room coverage do we have to cover? Is every single day? So for Max and I, it was 7 days a week.
Maybe just, sorry, I don't mean to interrupt you, but maybe just explain to everybody also what a training room even is, because I think we're going to have people who are at different levels of education.
Sure. So a training room is a separate clinic specifically for athletes. You could see anything there. You could see just regular kind of like urgent care type of illnesses, or you could actually see MSK injuries there. And that's a clinic specific for your athletes. And that happens at a certain time of day. It depends. Different programs have a different time. Our program had them in the afternoon, like around 5 p.m. Was our time. And we went 7 days a week, but Max and I split it. So every other week, so I would do 4 days. One week he would do 3, and then the following week I would do 3, he would do 4, and then we'll switch. That way we make sure that we that we don't get burned, because it's fellowship is really busy. It's kind of like intern year a little bit. You're trying to get everything packed in there, but also it's very time consuming. So you have to be really prepared for that and see what your the requirements and expectations of you as a fellow is. So it's really important.
And Micah brought up a good point also in the chat, which is to ask your people at your interviews how the training room is being affected by COVID. Our training room, for example, was canceled entirely for several months due to this, and then only transitioned into maybe a once a week or twice a week thing after that, right?
Yeah, it was, we went like the last week or two that, but for us, we were really lucky that our fellowship got canceled when basketball was already basically over. So there really wasn't a lot of coverage or anything. We already got the football in, the basketball, the runners, the wrestlers. We already got everything. So for us, we were pretty lucky.
Just to talk about also some specifics, if you're looking at what the life of a sports medicine doctor will look like after fellowship as well, you're going to be seeing between 20 and 50 patients a day, depending on the type of practice you get into and how aggressive you want to be as a physician. You can expect to have somewhere between 0 and 3 nights a week at some times of the year taken up by sports coverage and training rooms. And it's not going to be more than 3 probably, Ken, right? That would be crazy, wouldn't it?
Depends, yeah.
And something to keep in mind is that most fellows coming out of training will be accepting a position which is a blended practice, including their original specialty as well as primary care sports medicine. It's unusual to find a perfect 100% sports medicine job coming out of fellowship, especially in an area that you want to be geographically. So while it's possible to find 100% sports medicine in the Midwest, for example, or in rural areas of Texas, if you're looking to be in a metropolitan area, more than likely you're going to have to accept the work for several years of a blended practice, continuing either emergency medicine, pediatrics, PM&R, family medicine, whatever your base specialty is, while you try to build up your sports medicine repertoire. And this comes often from personal work, covering sports events for free, creating relationships with high schools and universities on your own as the sports medicine coverage, and billing yourself as something within the university program or within the group that you work. And this can be difficult to do. It's not a simple thing, and it's something that I wasn't totally aware of before starting fellowship, how ubiquitous it is to be in a blended situation, often for a number of years before being able to be 100% sports medicine.
Yeah, with that being said, it's not like you can't land a job with a university program. There are definitely some that are hiring. It's especially at this time, it's difficult. A lot of the finances are being allocated towards COVID type illnesses, and it's hard to fund a new physician. And there's no sports, so if there's no sports, then why do you need a new physician? Yeah, so I agree with Max. There's likely you're likely going to have to work your primary specialty and do maybe a little bit of sports medicine here and there until you're able to secure something. With that being said, also, I would encourage everybody to start building your CVs. If you're currently in fellowship, start building your CVs, build it up, and start applying. The sooner the better, to see exactly what's going on, how the market is, and how the jobs are going.
Is that something that we want to? We can talk about it later.
Mm-hmm.
Let's. I'm going to use that actually though as a jump off point for I think our last sort of general big topic for the evening, which is how early is too early, and what do you want to do to distinguish yourself as a good candidate overall? And what did Ken and I do specifically? What did we do to distinguish ourselves? How did we get into primary care sports medicine fellowships? And so I think philosophically, programs are looking for individuals who understand what it means to be a sports medicine doctor. So understanding that it's more than simply seeing orthopedic pathology at the clinic or at the training room, but understanding that it also means being an advocate for athletes, discussing things with parents, with coaches, with athletic directors, being the point person with athletic trainers, and understanding what it means to be like on a sideline, what it means to be on a sideline of an event. I don't think it's ever too early to be thinking about getting into a fellowship. And that's because fellowships are looking for people with longitudinal experience and interest. If anybody has not, for example, already joined the AMSSM organization, I would really encourage everyone to do it now. It's a great way to demonstrate interest in this, and programs will ask about it and we'll look at it. I have some more specifics, but Ken, anything you want to add to that initially? I think you're muted, maybe.
Yeah, if you're new, you're starting the application process, you definitely need to be a member of AMSSM. That's our society that sports medicine docs are part of. It's just like if you're a family medicine AAP, so it's you need to be part of society to make sure that you show interest in it. And as far as coverage, you have to. Do you guys hear the dog in the back?
Yeah.
Yeah. All right, you guys keep going. Let me mute it.
Sure. So, some things that I did and what I think I would recommend that people do is to try to get as much exposure as you can during residency in the sports medicine world. And I think this comes from a few different areas. One is, of course, joining the MSSM. Two is getting to know the sports medicine personnel at your home institution. And if there isn't one, seeking out the people who are covering the sports medicine events in your area. I would say that more important than going to to one event or to one sport many times, being able to demonstrate knowledge of many different sports is in some ways more important. So I would say that I had a moderate level of experience in terms of sports coverage coming into fellowship. I had covered Division I basketball. I had covered a little bit of pro tennis from a tournament that was in my area and a couple of mass events, big races. And I think that is a good smattering of things that a fellowship would like to see. They want to know that the person that they're taking, again, has an understanding of what it means to be a sports medicine physician. And a great way to demonstrate that is through coverage of various events. All good, Ken?
Yeah, you could probably still hear in the background. I do apologize for that.
All good.
You want me to add
Ken,
to it, or you keep going?
No, add to it. What did you feel distinguished you as a sports medicine candidate?
Yeah, so my residency had no sports coverage. They cover a local high school, and that's about it. So what I did is I reached out to everybody in the local community. Hey, there's a few races. If there's an Ironman coming up, there's a marathon coming up, there's a oh my God, I forgot the name of it now. But so I reach out to multiple races and say, hey, can I volunteer? Can I volunteer? So that's what built up my resume. I know it's going to be really tough now with COVID-19, with the races being canceled, we're having minimal staff, but still, if you find a race nearby, reach out to them and say, hey, can I volunteer? Can I be part of the medical staff? And you're going to learn a lot of valuable information and training from there. I covered a lot of like ultra marathon races and Ironman, which I've seen a lot of exertional heat injuries, which I feel like it's invaluable to treat heat stroke. So it's really, really important just to get out there and show that, hey, although my residency was limited with the coverage, I went above and beyond and I saw out all these extra coverages. So that I feel like that's what kind of made me seem a little bit more and why they ranked me higher than Max, but whatever, just kidding.
So I have a couple of closing thoughts about sports medicine fellowship, but again, we'll leave it open for a minute now if anybody wants to ask any questions or feels like that we haven't covered something. Even if you joined the lecture late, I'm happy to try to recapitulate something that we maybe covered earlier in the lecture. I think that doing a sports medicine fellowship, though, is a really exciting thing to do in one's career. At the end of the day, feel extremely happy that I did a fellowship in this as somebody who was not, I'm going to use the expression, hell-bent on doing one from day one of residency. I did not walk in as an intern thinking that I was going to do a primary care sports medicine fellowship. And now on the other side of one, I'm extremely happy that I did. I think that my career trajectory and who I am as a physician is going to look extremely different because of having had this 1 year experience. It's a year of sacrificed income, but I think on the other side, I feel now like a specialist in something new, and it feels exciting, and I really enjoyed it. Ken, what do you think about that?
I agree. I agree. And I'm sorry, he's probably barking again. Sorry, let me mute. Keep going.
So we got a question. Do we see other programs withdrawing from the current application process in order for their current fellows to get thorough training? It's not something that I've heard actually of, Neil, heard of. Have you been seeing that from places? Have people been noticing that applications are getting withdrawn? My thought overall is that fellowships are, if they start to withdraw, are going to be in danger. Is this University of Rochester or Rochester Regional University? Okay.
So yeah, I think it's a great question. You should definitely ask, because like if your education is compromised for whatever reason, you should be able to have the option of actually going to fellowship or not. Although when you are selected on ERAS, it's actually a contract, so I'm not sure. That's definitely a question to ask the fellowship.
Yeah, because they still took the application fees. That's awful. Maybe just to give everybody some more perspective, also, the AMSSM is considering extending all fellowships for primary care sports medicine fellowships. They're considering entering into a 2 or 3 year fellowship in the future. This is going to be more similar to how Australia runs their sports medicine physicians, where they are more of a true subspecialty, where you really get 3 years of specialist training and then come out of fellowship extremely altered by the experience as a physician. And so I think fellowships may be experiencing some tension around that, if that's the way that fellowships are run in the next couple of years, if they decide that they want to push that through as a change. So I think that it's something to be aware of, but fellowships still ought to be able to handle the number of fellows that they're going to be having, that they should still be able to accommodate you as a fellow, despite potentially having more training for the fellow that's currently there. So I don't know if people would have been aware of that. There was a question, did we have any exposure to sports nutrition? And if so, did we think it was valuable? We had very limited exposure to sports nutrition. I think we had 2 lectures about sports nutrition, and one was tied in with steroid use in athletes. I would say that it was something that we got low exposure to, but also didn't think it was particularly valuable, the way that it was presented to us. It's something that I wish that I'd gotten more of. Sorry, yeah.
Yeah, some programs actually that's one of their selling points. When they actually let you rotate with a nutritionist. I'm with Max. We didn't get that much, and I didn't feel like I needed it. But I don't know. To each their own.
Yeah, I think that's reasonable. I don't think it's going to make or break you as a candidate, but it's something that I'm personally interested in, and I've read a fair amount on, independent of the fellowship that I went through. So I think we're going to end the lecture then here. I'm impressed that we spoke for so long. No, sorry to keep you guys here all night. I appreciate you guys making it to the new time. If there's any question that we didn't answer, or if you feel like there are things that come up afterwards, send us an email or shoot us a message on Instagram. We'd be happy to try to weigh in about it. We're going to post some version of this lecture as well for anybody who missed the first part of it, as well as our guide to how we think people should be thinking about getting into fellowship, as well as the questions that we think are most important to be asking at fellowship interviews, how to distinguish yourself as a candidate, and especially in light of COVID-19. So, Ken, anything to add otherwise?
No, just thank you guys for the support, and if you guys have any questions, suggestions, feel free to message us. Other than that, thank you guys for tuning in.
Yeah, we really appreciate it.